The International Guidelines on Human Rights and Drug Policy provides a comprehensive set of human rights standards applied to the entire human experience of drug control, from cultivation to consumption. The guidelines were a result of a robust 3-year participatory process with governments, civil society, academics, and UN partners. They were developed in partnership with the World Health Organization, the United Nations Development Program, the Office of the High Commissioner for Human Rights, and UNAIDS. And since their launch in 2019, we've started to see a range of implementations experiences taking shape around the world. These global experiences are demonstrating the power and the possibility of placing human rights at the center of drug policy reform processes.
The guidelines don't invent new rights. They reconcile human rights, the international human rights framework, with the 3 drug policy conventions. And they help us provide policy advice and technical support to governments and partner with all stakeholders of how you can actually develop drug policies that are compliant with the drug conventions, but can focus on human rights and public health more and rather than on enforcement and punitive measures.
In many countries, we know that drug policy has been based on the punitive approach, but it didn't work. So shifting that, we have these international guidelines on human rights and drug policy, helping the government to developing a drug policy which is based on human rights approach.
The guidelines are crucial because they show that the idea of taking human rights into account with respect to drug policy isn't some pie-in-the-sky abstract notion. There are ways concretely that as policymakers and as the public consider these, and wrestle with these tough issues, that it can make it real and detailed.
It's really amazing actually to see how the guidelines have been used in national level policy discussions. The international guidelines are also mentioned in the previous EU drug strategy, for example, explicitly. It's an incredibly important document that I think the whole of drug policy reform really stands behind and leans on heavily.
Colombia was the first country to include the international guidelines on human rights and drug policy into the national policy. So they were very, very useful to sort of focus our change in policy. And it was very useful to present it to society, as a presentation to society. It was very useful because, as you know, we decided that we will no longer have a drug policy focusing on law enforcement against the lowest levels of the chain, the coca bush growers and so on, and the micro traffickers. That we wanted drug policy that will seek enforcement against the higher echelons. But beyond that, I have to say that we have turned human rights into one of the pillars of our international engagement. And this is aspirational because I come from a country that has huge human rights problems. We know the country we want to be, and that's why we have mainstream human rights in all our foreign policy activities.
In our work in the Justicia, we started using the guidelines around the right to a healthy environment, and specifically on the recommendation that the guidelines provide on the prohibition of use of agrotoxics in reduction of coca crops. In that moment, we were experiencing the very high risk of resuming aerial spraying of illicit crops, which is very harmful to human health and the environment. And the guidelines gave us the legal arguments to be able to provide high courts references that were strong into international human rights standards and to why it was needed to limit the use of this practice in Colombian drug policy strategies. So the Constitutional Court in Colombia has been one of the first high courts in the world that has referenced the international guidelines on human rights and drug policy. It was used in this court case around forced eradication with aerial spraying, but also around drug use in public spaces, freedom, autonomy of personal use of drugs. Furthermore, we've also used them just in general advocacy with government partners.
The international human rights guidelines have been very effective for us to use when in 2023 we had done away with the death penalty or the capital punishment for drug-related offences. The international human rights guidelines, they've been the guiding principle for us to follow in having a more human rights-centric approach and a harm prevention and harm reduction approach as opposed to going for strict punishments. We're trying a different approach this time, and of course those international human rights guidelines have been very effective in formulating the policy and shaping up the policy that we have, which is human rights centric.
We have been using the international guidelines on human rights and drug policy as part of developing a human rights-based approach to a situation in Scotland where we have the highest recorded drug-related deaths of any country in Europe. So I was asked by the Scottish Government to help develop the shift from criminalisation and stigmatisation of people affected by substance use to a public health and a human rights-based approach towards people affected by substance use. And so the process that we've been leading for the last couple of years is to develop a charter of rights for people affected by substance use. And that's been done through a process of empowering individuals and communities to understand their rights and to build a charter and a toolkit for its implementation. And we've also involved in a collaborative way what we call the duty bearers, the decision makers across design, delivery and monitoring of related services. And together we've produced the charter and the toolkit to implement it. It was launched at the end of last year with the support of the First Minister of the Scottish Government and the Office of the High Commissioner for Human Rights. And we're now just embarking on the next phase, which is the implementation of the charter.
The international guidelines on human rights and drug policy have really been very useful for me as a country, Ghana, because when they were launched, that was the same period when we had passed our new law on drugs. We thought it was necessary to begin to bring everybody on the table to see how these guidelines can help us identify the gaps in the law and how we can plug in to address most of the challenges. So in April 2022, we organized the first ever national dialogue, which brought together key national agencies like the Ministry of Interior, Ghana AIDS Commission, the Human Rights Commission. We brought together the Ministry of Foreign Affairs to discuss how, as a country, we could ensure that these laws really reflect human rights provisions that protects people who use drugs, and also to ensure that we put in place services. Through this dialogue, we also identify a gap like harm reduction. And as we speak now, we have kick-started harm reduction in 2022, which was a pilot, and we have now substantively begun a nationwide program. We developed what we call a national stigma reduction roadmap for people who use drugs, which was launched, and currently many of the institutions are using this a lot of the time to address issues of stigma.
We were involved in the dissemination and the presentation of the guidelines on human rights and drug policy in Latin America. We organized an event in Mexico, and since then we've been using the guidelines to sensitize other NGO members, other activists in Mexico as to politicize them and to help them take action in shaping new drug policies and alternatives to prohibition and to the war on drugs, but also to use the guidelines as means to evaluate or better incorporate other indicators into the evaluation of drug policies in Mexico. We've also tried to use the guidelines to sensitize decision makers for them to understand how to balance policy priorities and also how to incorporate the approach of human rights into their decision-making processes, whether legislative or executive, in implementing programs and policies. So far, we've made advancements, particularly in the gender front. There's still a lot to be done in terms of discrimination, stigma against people who use drugs, but also in terms of better integrating human rights indicators and actions in violence reduction and the control of the supply chain.
We are now rebuilding the policies for prevention and social reinsertion in the scope of the drug policy in Brazil, it's extremely important that we look at the rights of people who use drugs. When we talk about prevention, we are not talking only about prevention of drug use, primary prevention. We are also talking about developing a prevention policy in a context of inequalities in the country. We have been discussing and developing the concept of a comprehensive prevention. That is a prevention that talks not only about drug consumption or substance consumption, substance use, but also about crime, about violence, and related deaths. And to discuss that, we definitely need to discuss human rights policies. So we have been developing the drug policy in close cooperation with the Ministry of Human Rights in the country. And in this sense, the international guidelines on human rights and drug policies has been a fundamental instrument to develop and to rebuild these policies.
We were providing to these guidelines some our cases, but the most important part was the regional consultation we did for the guidelines, using the guidelines, but that was important moment of uniting academia, state government representatives, the human rights officers and ombudsmen from the countries, and civil society and community of people who use drugs. Of course, it's like with the changing political environment, it's very hard to achieve what we wanted, but actually the guidelines supported the development of the key priorities and we're still following them.
I want to believe that this book would be helpful, especially at this time when human rights is under threat and the service is under threat. We can just remind to decision makers and to stakeholders why it is important. And for instance, if it's a countries like, I don't know, Moldova or Ukraine with the status of candidate to EU, you always have to remind this human rights agenda. And it works, in fact, it works because there is certain obligations to follow and to be then finally considered to be a EU member state.